You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
ATS 2026 is just coming up, only a few months away, and the early bird deadline is March 12th. Joining us today is ICC Chair, who is in charge of everything that's going on. If you were there last year, it was just an amazing experience. Dr. Jennifer Taylor, your cystic fibrosis expertise, and how does that lend itself to organizing conferences?
Well, I actually do not only patient care, but I also do clinical research. So I read multi-center clinical trials. So I have had lots of leadership experience through that. And I also run our program, including our CF research program here. So that has given me some perspective on the different aspects that go into a conference.
Give us some overview of what to expect.
I think it's going to be another phenomenal conference. Even though there was some question about going to Orlando, we actually have had a number of really good signs that people are excited about coming. So we have more abstracts than we've had in several years. There are also more programs submitted. So I expect some excellent science and great education, as you see every year at ATS.
What kind of perks they get, and the website is live now, so they can see what all is going on.
So March 12th, if you get your registration in by then, you get a substantial discount. And also, once you register, you can start planning your conference. So ATS 365 is live right now, and that's the site where you can go and build what you're going to see while you're there, whether it's going to a postgraduate course or going to a symposium. All of that's already live on the website.
Okay. So last year I was there in San Francisco, and that was, I'm just blown away about everything that was there. And I was reading that there are 557 education and scientific programs, 6,956 abstracts, 29,000 speeches and authors, and several hundred exhibitors. That's quite an undertaking, quite a job that you have to oversee.
Well, fortunately, I have a fantastic team, both with the ATS staff and the International Conference Committee. We also collaborate with other committees like the International Health Committee and the Network Supercenter Committee and the Early Career Program. So there are a number of people who are working really, really hard to make sure this conference goes as well as it always does.
Yes. And I was just told that this conference has been going on for a century
Yes.
and, of course, changed.
Of course, it's changed over time. I think it's just gotten bigger and bigger. And of course, there were some years where it was smaller during the pandemic and had to be virtual, but it is a conference. It's the premier respiratory conference, I think, in the world.
Right. So bronchitis, COPD, allergy, immunology, sleep medicine, pediatrics, ILD, IPF, health equity, critical care, cellular and molecular biology are some of the topics that I noticed last year. Is similar this year? And are there any some amazing speakers? I interviewed Geiger last year, and his story was so inspiring, and it just brought tears to my eyes. Anyone that stands out?
Well, I think I was on a call the other day where the patient representative group was there, and I think they had 20 patient speakers in some of the sessions, which I always think is really, really helpful to center people and remind us what we're doing and who we're doing it for. But I think a couple of the big highlights, the first keynote on Sunday is going to be by Dr. Dimitri Daskalakis. He was formerly a director at the CDC in the HIV division, and he is an activist and an amazing speaker. So he is going to be speaking about vaccine science on Sunday morning at 8 a.m., and that will be moderated by Dr. Katie Heiser, who's an associate professor of medicine at National Jewish. Our second keynote is Professor Steve Baddick, who is actually a professor of law at Georgetown. And Josh Fessel is actually going to interview him about the impact of law on health.
Okay. And you begin the conference with some early career programs and actually hands-on stuff that they can take with them.
Yes, it's really, really important not only to educate and talk about the science with the senior people, but also make sure there's a pipeline of people who are going to continue in pulmonary and critical care and sleep medicine. So there is an early career program that begins before the conference. So there are student scholars, which can be high school students and college students. There are also workshops for junior faculty and fellows and residents. So resident boot camp, fellows boot camp, and new faculty boot camp. And in those sessions, there'll be some didactics, but there'll also be opportunities for hands-on. So for example, the student scholars are going to learn how to listen to the lungs. The fellows are going to practice their bronchoscopy skills. So there's both teaching that happens from the staff, but also there's hands-on opportunities that they can take home with them into their training programs.
And this is for 4 days.
Right.
Okay.
And
And,
the student scholars are 3 days, and then the resident and faculty boot camp for 2. And we also have postgraduate courses that are open to everybody that also happen before the conference. And those, again, range from an update, for example, on all that's going on in COPD, and that could be a half day or a full day, or you can be going to something like an ECMO course where you're learning how to use ECMO, and again, hands-on, you can take that home with you.
Early bird registration for ATS 2026 in Orlando is now open. Register now and save. Members get a discount, so become an ATS member or renew your membership to take advantage of the savings. Visit conference.thoracic.org today.
and what are the journal sessions?
So the journal sessions highlight some of the late-breaking science that's happening. So the New England Journal of Medicine, the Blue Journal, and JAMA, all the editors get together, pick the top science that's coming out around the time of the conference, and those are presented in the journal sessions. They're usually standing room only.
And then, clinical trial sessions as well.
Yes, the clinical trial session is another, I think, highlight of the conference. And again, last year before, standing room only. So this is a session when we talk about the phase 3 trials that are immediately going to start impacting care for patients. So again, those are under embargo, so we can't talk about what they are yet. Actually haven't finished picking those because they're just getting their science in right now with a deadline of April, I believe.
And anything else that, you wanna mention, about organizing it? It must be just a huge responsibility.
I mean, I think it is, but again, it's a teamwork sort of thing. We had 3 big meetings with the whole ICC during the course of the year. We just had one in December. We programmed the symposia in one of them. We programmed the abstracts in another, and that's when we did it in December. So we all work together to make sure that the conference is fantastic.
Okay, so where in Orlando is this taking place?
At the convention center.
Okay. And it seems like a wonderful place to go right now because it's freezing where I am, and some sunshine will be good.
There's
Um,
lots to do, obviously, in Orlando, in and around Orlando. I think 2 other things I'd mention about the conference that I think really says a lot about what ATS is as a society and the amount of care they have for their members is that we continue to have the Women's Forum and the Diversity Forum. And I actually will have the honor of giving the keynote at the Diversity Forum this year.
when did you first attend?
ATS, oh gosh, I think that probably would have been 2006 when I was a fellow. So a long
Okay.
time ago.
20 years ago. And why do you keep attending? Is it for the networking or just a lot of amazing, interesting science coming out of the conference?
All of it. So it's the education because there are things that I don't have time necessarily since my focus is CF and CF research that I don't always keep up on as well. So I can catch up on them when I go to ATS in terms of education, in terms of science, and of course the networking is phenomenal.
Okay. And what else would you tell people if to get them to register? And there are so many people coming from other countries. I noticed last year, it was just amazing. Almost every country.
It truly is an international conference and it's an international society. About 30% of our attendees were from out of the United States.
Wow, that's a lot. Which country most?
I believe that it was well combined Europe for sure.
Okay.
We did have a big showing from South America as well last year, but
And
as far away as Africa and Australia. So people come from all over the world again because it's the leading respiratory conference in the world.
yeah. I met a lot of people from India as well. How many months in advance do you start preparing for something like this?
A year. So we'll start planning for 2027 the day that the conference ends. So you literally have an ICC meeting that afternoon.
So in San Francisco, immediately after last year, you just decided
Jump
to
right in.
let's take it to the other side of the country. Um, and anything else that you want to mention?
I think that the attendees also make the conference. The programming is really important, but the people who are there and the opportunities to network and to mentor and be role models for the junior faculty, like that is really, really critical. So I expect to see a lot of you there.
And I'm surprised that 30% are coming from overseas.
Again, I just think it's because there are so many education opportunities, so many opportunities to learn late breaking science as it's coming off the press, literally, because the journals are releasing those articles often that morning that they're being presented. So I think that those things really draw people to the conference. And again, ATS cares about its members and it programs with the members in mind. And I think people feel that.
Okay. Dr. Taylor, world-renowned cystic fibrosis expert in Denver. Thank you so much for joining us today, and I look forward to meeting you in person coming up in May.
Thanks for having me.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.